I'm Emma Evans, and today going to be talking about addiction and how it links with social support. What is addiction, you ask? Addiction includes the excessive use of a variety of illicit substances, such as drugs, tobacco, and alcohol. All these toxicities give us a temporary sense of freedom, escaping from our realities. Individuals with social and economic disadvantages may become dependent on alcohol, illicit drugs, and smoking tobacco. Social support is having strong relationships and supportive community networks. Addiction and social support are linked because the lack of social support dramatically leads to these addictions and a feeling of social isolation. Some key facts about addiction are in 2015, mental and substance use disorders accounted for 12% of the total disease burden from the Australian Institute of Health and Welfare 2020. AHW 2020 states that in 2011, the leading causes of total disease burden that Indigenous Australians experience were 19% mental and substance use disorders. Some potential health effects of addiction could be lack of judgment, lack of rational thinking, which leads to not thinking rationally. AHW 2020 expresses that for women aged 25 to 44, partner violence is the third leading risk factor for total disease burden, being child abuse and neglect during childhood and illicit drug use. Wilkinson and Marmot 2003 declares the potential health effects of these substances have consequently been linked to death, violence, domestic violence, poisoning, injury, and suicide. In conclusion, the social determinant of addiction can have a variety of potential health effects. Wilkinson and Marmot 2003 states that addiction and social support are linked because low levels of social support may lead to addictions and social isolation. The purpose of this presentation was to explore social determinants of addiction and social support and how they are linked. The relationship between these two determinants can have a greater influence on health.